Jackson Health System is made of 6 hospitals and about 12 satellite facilities that provide primary care and specialty care within the Miami-Dade community. We have 7.6 million square feet across the entire health system of occupied building space that our department manages. At any one fiscal year, we would have 40 to 50 active projects being supported in some various shape or form to the tune of $50 to $60 million a year. Each project has its own strategy, and each strategy is supported by a business plan and a return on investment. And the quicker the health system can capitalize on those projected return on investments, the better off the health system is from a financial sustainability. It's our obligation to get those projects completed so the health system can then provide more services to the patient population. When the JOC initiative was introduced at Jackson Health System, it was new for the contractors in the Miami-Dade County area specifically, and it was new for Jackson. So there was an adaptation period on both sides of the industry and us, Jackson, using the program.
We've issued multiple JOC solicitations. We've issued one in 2008, 2011, 2013, and we just issued one for 2016.
Over the course of time, we've gotten to a better status quo, and we've gotten above par in using the system and gaining experience with the contractors in our pool. We've completed a blended mix of projects. They range from new construction to medical equipment replacements to interior renovations. Some of the highlight projects of our JOC contract here on main campus, we've done a number of patient floor modernizations within the West Wing building, which is our adult patient care setting, and our Holtz Women's and Children's setting. Some of those floor modernizations were 16,000 square feet, a 37-bed unit that we went in and fully modernized, made environmental friendly, added new technology, made ADA compliant, and also brought it up to current local code standards. And in our Women's and Children's Health Center, some of our maternity wards were old and dated, and we went in and renovated. We also used job order contracting at our South Campus, where we installed a helipad on top of the Jackson South Community Hospital in support of a trauma initiative so we can span our level 1 trauma service here on main campus to gain a level 2 trauma service at our South Campus.
The good thing about job order contracting is everything's already in place. Once we make an award recommendation and the Board of Trustees approve those awards, we already know the contractors are qualified to work here in the hospital, and so we can just utilize that JOC contract as an umbrella contract for work orders.
It allows you to skip some of the procurement process. That helps with the speed to market and getting these projects off the ground and these initiatives done quicker.
Cement risk and design build is a more involved process. A full-fledged formal ITB can be on the street from 6 to 8 months before we make an award. Where with a JOC for the projects under $1 million especially, we can just go to whichever JOC contractor is applicable, and we sit down with them, go over their scope of work, they provide their proposal, and we can issue a purchase order within 4 to 6 weeks.
The good part about it is job order contracting allows you to become a working partner with the owner. You have a fixed unit cost for whatever construction supplies that are needed, so the process becomes more transparent.
I believe Gordian has put in a lot of time and effort in reviewing those prices, and I believe they're very accurate, and I can tell based on those bid submittals we do receive, they're all pretty consistent. When I started here in 2008, we had a small staff of 4 people doing all the construction for the whole Jackson Health System. And now we're staffed to 7 people, but because of JOC, we've done the cement risk projects, we've done the major A&E projects. Since we've been completely staffed, JOC has really allowed us to hit the bigger, more visible projects more quickly and still have those smaller repair type work being done as required.
All the projects that we've done through JOC particularly went smooth, and I would strongly promote job order contracting as an alternative procurement method for projects that you can control.
So yes, I would absolutely recommend job order contracting.
It's a good tool to use.